welcome back to another episode of It's Okay Not to Be Okay. For today's episode, we've decided to dedicate it to talking about OCD, what it is, how it shows up, the hope of, not hope, but treatment, how treatment can look like, maybe even talking about loved ones and how loved ones can help. And helping us today is Dr. Buksani. Understand a little bit more. Hi. How are you?
Good. Let's talk OCD. We don't see, let me first preface by saying we don't see, at least, in private practice, we tend to see fewer OCD clients because I think there's more specialized treatment centers that specialize with OCD. But I've dabbled in a few myself, and we can talk about those and how, or what kind of techniques I have used, and also, of course, the gold standards that are out there.
Yeah, perfect. Well, thank you. Like always, to start off like as simple as possible from the first point, do you mind explaining what exactly is OCD?
Right. So OCD comes under the umbrella of anxiety, right? So right there, you know that it's driven by anxiety. So when we talk about OCD, it's Obsessive Compulsive Disorder. And remember, we've talked about disorders. So because I feel like anytime we do episodes like that, everybody's going to start finding themselves, oh, but I do that, right? So I want to preface by saying it's not a disorder until it affects your social, emotional, and occupational functioning, right? So it really has to cause disruption in your day-to-day living for it to be, classified as a disorder. So having said that, obsessive compulsive, which means, and if you break that down, so obsessions and compulsions. So what are obsessions? They are intrusive thoughts. So, those thoughts, it can, and most often they're related to fears, right? Like, oh, if I don't do this, something bad will happen. If I don't wash my hands, then, it's very ritualistic almost, right? Like, if I don't do this, then something will happen and something bad will happen. So that's kind of your intrusive thoughts and, surrounding those fears. The compulsions are the actions you actually take to deal with those thoughts. So, if I'm saying, oh my gosh, I have to drink this water, because if I don't, I'm going to faint. Okay, so now what am I going to do? I'm going to drink this water because else I'm going to faint, right? Or like, oh my gosh, I have to have X amount of water by so and so time because otherwise something bad is going to happen, like I'm going to faint or I'm going to pass out. So the compulsion is the action that is a result of the anxiety that I feel because of the obsession. If that makes sense.
Yes.
Right? So I've had clients who feel like, okay, I need to go around my bed 10 times because otherwise something bad will happen. Right? Now, if you did that once in a day, okay. The problem with OCD is that fear is so intrusive that it doesn't go away, right? So I almost spend the whole day going around the bed because I never get to that point where that fear has left me enough to be able to function. So your classic, like, okay, I'm going to wash my hands because I'm a germaphobe, right? But an OCD is a person who's okay, constantly washing hands, but it never gets to the point where I feel like, oh yeah, okay, this is good. I'm good with this. I can go and function outside in the world. So that is where it then gets classified as a disorder because I'm unable to function.
Yeah, and at the beginning, I like how you also mentioned how it should be classified to be then a disorder, because I feel like nowadays, every other sentence, some people are like, oh, I need my binder this way, or I'm very OCD. Yeah, like the term has been thrown out loosely for I don't know how long, and then at some point it might affect people who do have OCD to just hear it like
absolutely
being thrown out.
Right. And that's one of the reasons why we're doing this, right? because we don't want people who are actually struggling with these disorders to be, for that to be minimized just because we are throwing those words around very loosely. So yes, I think it's important to be aware of that.
Absolutely. And then, okay, so like after understanding what OCD is, what does treatment for OCD usually look like?
Right. So OCD treatment, so sort of the gold standard of treatment is exposure and response prevention therapy, right? So what that does is, it's like systematic desensitization. So what it does is it kind of slowly, introduces the trigger, so what your fear is, and then helps you tolerate the discomfort that you feel. So, and not engage in the compulsion, because it's very cyclical, right? So I have this obsession, and then I do the act, then it I'm relieved a little bit, but then my obsession comes back again. So I'm almost going around in circles. So what this does is it helps me face my fears, but without doing that compulsion. Now, additionally, I feel in my own practice, what I have used that I found really helpful are things like grounding techniques, mindfulness, right? Because one of the ways, and we know the gold standard for anxiety, is meditation. So if I can, use some of those mindfulness techniques, including meditation, to help, cope with that anxiety that I feel when I have those obsessive thoughts, I might not be compelled to perform those compulsive acts. One of the other techniques that I personally really love is ACT, which is acceptance and commitment therapy, which has a big component of mindfulness in it. And, to be able to accept that obsessive thought, because I can't fight those thoughts, but without having the need or feeling the need to, again, engage in the act, the compulsive act. So, I think in addition to that exposure therapy, I think mindfulness techniques are amazing to help heal or, manage those OCD behaviors.
Yeah, perfect. That makes so much sense. Thank you. Now kind of like switching perspectives for maybe loved ones or even close friends facing some challenges with like their loved ones facing OCD. Do you think there's a specific way or like a best way to support the person? Well, yeah, for the loved ones to support someone with OCD.
So it's difficult to live with someone with a mental illness. So I really want to emphasize that because I want people to award themselves compassion when they've got partners or loved ones who struggle with any mental illness, including OCD, right? And I think mental illnesses somehow are a little more challenging because they're unseen, right? So because everybody looks normal. So I think it's harder, and it's harder for society then to offer that compassion to the caregivers or the partners because they don't see it either. So I think, it's important to validate that it's really, really difficult and challenging to live with someone who has any form of mental illness. What can you do? First, please take care of yourself. It's very important. If you don't take care of yourself, there's no way you're surviving this. Generally, the instinct, Amanda, is that, okay, I want to go and help them. Okay, let me do something to help this person who's experiencing so much anxiety. But I would refrain from that. I really, when those roles get mixed up, where then you are playing, if this is, say, for instance, a romantic partner, but now you're playing the role of a caretaker and you're playing the role of a therapist, it doesn't work, right? So what you really want to do is have that separation and keep your role defined as your romantic partner, and make make sure that your partner is getting help, is getting therapy, is getting treatment for OCD or any other mental illness that they are, facing. So I think it's important to take care of yourself. I think it's important to have some sort of support system for yourself, while you are navigating, this challenge, but also to make sure that you're not playing therapist. And
Right.
you are encouraging your partner to be able to go and get the help that they need, and encouraging them to take accountability. When they are resisting, for instance, that compulsive behavior, to be able to say, "Wow, you know what? That's difficult. I'm so glad you're doing this."
Right.
Yeah.
I mean, okay, so for people who feel like they might be facing this challenge of OCD, do you have maybe any tips or advice as to maybe what their first step should be?
Therapy.
Yeah.
And there's some disorders that I feel are less challenging for the individual and people around them. All of them are challenging. It's just that the intensity, I think, might be lesser with some of the disorders. OCD happens to be one that's difficult, really difficult to deal with for the individual and the people around them. So I really encourage therapy. I think if we can encourage people who see those OCD symptoms within them to get diagnosed early on, right? Because there are ways of being able to manage these obsessive thoughts. And in addition, I would say meditation. If you can learn those grounding techniques, if we can learn those techniques of mindfulness, I think they are extremely helpful in trying to manage OCD, thoughts and behaviors, but also other mental illnesses.
Well, yeah, I feel like that answers, and I feel like that circled around a lot of the topic of OCD. Again, OCD, I feel like it's still a huge topic. I feel like there's always more to learn about it, but I thank you so much for helping us answer, what it is, how to help, treatment, what it could look like, and even how to support loved ones and how loved ones can support, the person they love. But yeah, thank you so much, Dr. Buksami.
Not at all, Amanda. Always glad to answer questions. Until the next time, I guess.
Until next time. Thank you.
Bye.
Bye.